Yeah. So abortion 411, webinar, legality and access. Just to know that in Haiti, as mentioned, and in the Dominican Republic, abortions are not only illegal, but you can be persecuted for them. As in, if someone finds out you have done an abortion, a woman has done an abortion, a person who's pregnant, or the doctor or clinician who did it, they can be arrested by law. Something to note too, that in the Dominican Republic, it's up to 2 to 4 years imprisonment and up to 20 years imprisonment for a doctor who has done it. In the Dominican Republic, abortions are not even legal to save the pregnant woman's life. So any health complications she may have, she will have to go through the pregnancy. So countries in the Caribbean where it's illegal and risky for abortions. When I say illegal and risky, I mean that it is illegal, but there's some clinics and some private clinics that will offer abortion services on some terms. However, if someone is to report it, then it may create a firestorm. So most persons try to avoid having this as a public discussion, like in Curacao, where our advocates have to change their methodologies and their strategies of having abortion advocacy. In Jamaica, particularly, they're now having a whole campaign, a whole movement with their National Assembly to decriminalize abortion services. We have some platform members on the call. I don't know if they want to talk about in the messages anything about that. In Trinidad and Tobago, there are some clinics that would refer you to someone who would do it. Particularly with Women on Web, which we're going to discuss earlier, that they would be able to support abortion services. But just know that in these countries, it's only as a life-saving procedure, which is mostly at the late stage of pregnancy. Then you have to look at illegal, but they don't really care. And an example of that would be in Suriname. So abortions are illegal in Suriname, but private clinics can offer the abortion services, and the government really does not restrict or jump in. But that does not mean that we should not advocate for the legality of abortion services in Suriname. Because at any moment now, if they have a change of government who is conservative, they can simply decide, well, we are going to fight down this, we're going to fight this down. The law is the law. No, we should always advocate to change laws so that women can be protected and so that healthcare professionals can be protected. Not because nothing's happening now means nothing's going to happen 20 years later or even 5 years later. And a perfect example of that would be in the United States, where whatever administration is in power can basically change terms, can change the law, can change access about abortions. Right now, under the Republican president of Donald Trump, we have something called the global gag rule, which threatens all of us as advocates for sexual and reproductive health and rights. Because the gag rule is more than just you can't speak about abortions. It's that we will restrict funding to you. If your organization supports it or publicly supports it or even does it, we're restricting funding to you. You're not going to get it. And in some countries, not some countries too, last year for the Commission on Population Development and the Commission on Status of Women held at the United Nations, the United States was blocking advocates and activists from entering the United States to go to UN meetings because of their strong stance for abortions. So this global gag rule really threatens all of us when it comes to abortion access, services, legality. And flexible, it's somewhat legal. And there's a reason I say somewhat legal because of the terms and the amounts of freedom that you would have for abortion services. Now, in Barbados, which is actually the first country in the Anglo-Caribbean to change their laws concerning abortions, it's on justifications or limits. Similarly with Belize, St. Lucia, St. Vincent, and the Grenadines. Now, St. Lucia and St. Vincent recently, as in within the last 10 years, had changed their laws to be more progressive. But when I say it's flexible or somewhat legal, a woman cannot request an abortion if she does not want to be pregnant. In these countries, a woman must satisfy one of 4 justifications to obtain an abortion. That is, it threatens her health or her life if she was impregnated due to rape or if she was impregnated due to incest. Other than that, then she cannot have an abortion done. fully legal. And there's a reason why you say fully legal. I talked to you about the somewhat legal, not the fully legal. Fully legal because a woman can request an abortion and it will be given to her, even if it's under a term. In such countries such as Cuba, Guyana since 1995, and in Puerto Rico, which is part of the United States. Now, why I highlighted Guyana there is because Guyana is considered to have some of the most progressive legislation when it comes to terminating pregnancies, not only in the Caribbean, but the entire world. Fully legal, on some limitations, on some terms, and I'm going to discuss it to you because advocates like to call these, anytime I express it to them, they call it the perfect laws or the perfect set of laws. Now, abortions in Guyana is governed by the Medical Terminations of Pregnancy Act of 1995. Fun fact, this year is 25 years since abortions have been fully legal and recognized in Guyana. It's legal. It's safe, affordable, and confidential. It is actually offered in public healthcare, some public healthcare systems and at private clinics. You do not need to have permission from your husband, your partner, or a parent or guardian. Abortions in Guyana, you do not, there's no age restriction. No matter your age, if you're pregnant, you will get an abortion. Consent is only asked of you, the person who is going for the abortion. Now, some people like to debate that it's an 11-year-old girl and she's pregnant. Should she get her parents' consent? Should the doctors even get parental consent? Now, the law was written in such a way to protect the dignity and rights of that person who's pregnant, knowing that circumstances being 11-year-old or under the age of consent, which is 16 in Guyana, that you're not comfortable talking to your parent, you risk being harassed, even violated, going through violence from your parents, and you also risk, unfortunately, through incest and you being raped. You don't want to involve a lot of people in that discussion and conversation. So the law sort of considers that, and that's why abortions do not have an age restriction in Guyana. It must be done by certified doctors or medical personnel. So you must be trained to do an abortion, and also your clinic must be certified to do abortion services. When done properly, a trained medical personnel, abortions are safe. They are one of the safest medical procedures done in the world. In Guyana, there has been 0 recorded cases of botched abortions by trained medical practitioners in certified clinics. So looking at these perfect laws about the limitations, and why I say these, that, why I'm showing you this is that if you're advocating, you're going to want to at least zero in and know what you are advocating for. So when some, for example, politicians who are very much ignorant of what an abortion is, thinking that it's done at very late stages, etc., you can tell them, no, what you're advocating for is that any person who's pregnant should have an abortion if they do not want to be pregnant. In Guyana, you have up to 8 weeks to make that decision. No reasons need to be given. It can be done in any setting by a trained medical doctor. When we say any setting, because abortions are by pills, most abortions are by pills, you just need to go to your doctor. They can administer you a prescription for those pills, and you can go home and take the abortion pills as prescribed. Once the doctor is trained, mind you, from 8 weeks to 12 weeks of pregnancy, an abortion can be done in Guyana, what you're advocating for, by a trained medical officer for the reasons as follows. If the pregnant person has been raped, if it was pregnancy due to incest, the woman is HIV positive, but you see, this law was written in 1995 when the HIV pandemic was still rattling societies. However, now you can be pregnant and not pass the HIV virus on to your child. So this particular one here, HIV positive status, it's still in law, but doctors can advise you that, okay, it's up to you if you want to go through your pregnancy or not. Take in mind, using this, because this is an example of what you would need to advocate for when you're advocating for abortion reform and laws. If it endangers the life and health, if the woman is unable to care for her infant, or if the pregnancy is a result of failed contraceptive, you can have an abortion done up to 12 weeks. Between 12 to 16 weeks, you can have an abortion for those terms. However, 2 doctors need to give the go-ahead. So they need to assess you, have a discussion with you, Somehow, of course, they're going to have proof that, you're either raped, incest, HIV positive, it endangers your life and health, you're mentally unstable, and you're pregnant due to failed contraceptives. Then up to 16 weeks, you can have an abortion. After 16 weeks of pregnancy, 3 doctors need to agree that, well, any of those terms has happened, and they would give the green light for you to have an abortion. After this time, of course, no, sorry. So after, particularly this point, it can only be done to save the life of the pregnant woman. It has to be necessary to save her life. Now, Caribbean laws. I just look at you of what we describe as the perfect laws, given that abortions are fully legal in Guyana. But I want to now give you a general sense of Caribbean laws. As I was reviewing this, I want you to know that most of these laws, particularly in the Dominican Republic and in the Eastern Caribbean states, they were written in the 1920s. They were written hundreds of years ago. These laws are outdated. They're irrelevant to us now. They're irrelevant because of our modern practices. They're irrelevant because of women's rights in the movement. They're irrelevant because of how advanced we are with our medicine. They're colonial, and as we can know, as newly independent states, we're trying to break away from a colonial system. These colonial laws were very repressive on a woman's right over her own body, something as simple as the dress code to we can tell you what to do with your body and what not to do with your body. So they're very repressive laws. The sentences are very oppressive. I did mention that in the Dominican Republic and in other countries in the Caribbean, you can be in prison for up to 4 to 5 years if you went to a doctor for an abortion to be performed. As for that doctor, him or herself, they face up to 20 years imprisonment and their license being terminated if they've offered abortion services. So that's 20 years in jail. They can no longer practice when they're out. And as for a woman, she suffers up to 5 years in prison just because she wanted to have an abortion. Now, these terms are oppressive. These laws are oppressive. What they do is that they subject women to discrimination and harassment in society. Because you've made something, you're still keeping it taboo, you're still rejecting it, you're still making women feel wrong and nasty and guilty. So your community judges a woman for having an abortion. Women are made to pay high costs to travel to countries where abortion services are performed. And this put them at an expense that they could simply save by going to a doctor. And unfortunately, women who can't afford to travel anywhere, for women who feel shunned by their communities, they will end up going to a bottom house clinic, or what we like to call bush doctors, to have botched abortions. I don't even like to call them abortions because they're really not. To have services done where they risk infertility, they risk sepsis, health complications, and death. As advocates, that is what we are trying to prevent. We are trying to prevent the death of women for something as simple as a health care service. Why should women be at a disadvantage just for laws that do not want them to express their rights over their own bodies? If we fail as advocates to educate and empower women and our entire community of their rights and their choices, if we fail to defend these rights, if we fail to protect their rights, then that would be the end goal. That would be the output of our failure. And I want us to look at that, particularly in countries like Guyana, really zone in on something that I find particularly sad. Yes, you can say abortions are legal in Guyana, full terms, but abortion access is still a major issue. Abortion access is still a major problem because you have countries like Guyana where you had to fight for abortions to be available in public health care. And I want us to look at this case where a teenager died after a botched abortion was done in a private clinic. Now, an 18-year-old girl is dead after being subjected to a botched abortion conducted by a private clinic. She was already a mother of two, and she's 18 years old. So what happened? She went into a bottom house abortion to someone who was not certified to have it done. What that person ended up doing to her was perforating her uterus and damaging her bowels. That is to say that the person did not perform any of the two abortion services that I have shown you, which is the medical and the surgical form. That person basically put something into her vagina, a sharp object, and punctured her organs. She was 4 months pregnant and she was continuously asking to have an abortion done. She already had 2 children. And one of those children is 4 months old. So look at that. And now we're going to be discussing why women have abortions and why we should defend a woman's right to have an abortion. Because this woman, this 18-year-old, already is a mother of 2. She's pregnant. And she already had a 4-month-old baby. Now that is very dangerous for a woman and can really degrade her health. She was begging to have an abortion done. And she ended up going to someone who was not certified to do that. She begged, she asked her husband to have an abortion done. The husband did not want to give her money, but he eventually gave her some money. He left to work. She went to say she had an abortion. He was upset at her. She started to vomit, and then she was at the hospital. But unfortunately, at this point, she could not be saved. This is her. These are real women with real stories and real experiences. Death of Bartik, a woman, doctor fingered in botched abortions. This was in 2015. Now, this is the death of a 23-year-old woman who had an abortion done on her illegally by a clinic that was not licensed by the Ministry of Health. This is a woman who went into the hospital to undergo surgery to repair a perforated uterus. Again, we're having a case of a country where abortions are legal, but there's no abortion access, there's no education, there's no upholding of those rights, there's no upholding of those services. Women are not knowledgeable of those rights, even in a country where abortions are legal. So this very young woman, 23 years old, had to get an abortion done, went to a clinic for someone who was not certified, and again had her uterus perforated, basically choked, bored, stabbed from the inside, because we are not giving women the education and empowerment to have these services done. And we do not know the experiences of why. I show you the first experience of a very young woman, 18 years old, already pregnant, already had a 4-month-old, wanting an abortion done. Now, this woman here is a mother of 3 months. She was pregnant for 3 months. She wanted the pregnancy terminated. And here's the thing. The doctor just explained that she was slightly paralyzed. That was it. Whatever he did, he paralyzed her. And you can imagine the pain these women go through. The pain. This is her. And we must look at these women to realize that we are advocating so that women do not go through what they had to go through. It is very sad to think that we are denying, we meaning society, are denying women these rights to save their lives. To my brothers and sisters in Suriname, a Surinamese woman dies in the doctor's operating theater. And this is something I talk about with some women having to travel to countries for abortion services. Now, this woman traveled all the way from Paramaribo to have an abortion service done in Guyana, where it is legal. She's already a mother of 4 children. She is a mother of 4 children. One age 2, one age 3, the other 5, and the other at 7. She is 22 years old, has 4 children, and wants an abortion because why? She does not want to be pregnant. And we need to respect that. Some women do not want to be pregnant. Some women want to delay their pregnancy. Some women are not ready to be pregnant. And we must respect those rights. Now, she died in a clinic that was not registered. And here's what happened. So it was someone who had an abortion 5 months ago from Suriname, traveled all the way from Suriname, who had an abortion in Guyana 5 months ago, took her to the abortion clinic. The doctor then came out and told her that she had the abortion done, but the girl was not catching herself, meaning she was not recovering. She did not recover. She died there on the table. This is her. These are real women with real stories, with real experiences. And it is our job as youth advocates to defend their rights, to protect their rights, to fight for the rights of women, to fight for the rights of all those who are pregnant, to have an abortion if they request to do so for any reason that they would have, as long as it fits into, as I described, the perfect laws, as in you gave a woman the amount of time where she could have an abortion, and then there are limitations where it could be due to rape, it could be due to incest, it could be due to her health status, including mental health. And this is one of the cases of how people can think home remedies can help, how people can think taking actions into their own hands because their communities have rejected to help them, because their communities have made them feel wrong, because their communities have made them feel that an abortion is the most terrible thing. Women take it upon themselves to do it. A woman injects her abdomen with gramazone. For those of you who do not know, gramazone is a pesticide. It's a toxic insecticide used in farms to kill insects. Now, this woman died at the Georgetown Hospital after she injected herself with gramazone.